gonna knock on the door. I'm going to check my patient's chart. Come in, introduce myself. Hi, I'm Jennifer. I'm gonna be your nurse today. Can you verify your name and date of birth? I'm gonna check that with the armband. Okay, thank you. I'm here to recheck your blood pressure because the aide told me this morning that it was high, so I want to recheck it. So do you have any questions? No? Okay. So I need to gather my supplies. I've got my stethoscope, my blood pressure cuff. I want to clean the diaphragm and the earpieces of my stethoscope. I'm going to come in and make sure my patient's in the correct position. They're laying supine. They don't have any IV fluids in this arm. There's no catheter, a dialysis catheter. There's no bulky bandage. They have not had a mastectomy on this side, so I'm going to use the right arm to check the blood pressure. And I want to place my cuff on my patient. It should be 1 to 2 inches above the antecubital space and fit on there tightly, snugly. So I'm going to put my blood pressure cuff on, and then I'm going to estimate the systolic pressure by feeling for the radial pulse, and then I'm going to pump up the cuff until I can't feel that pulse anymore. So I would just keep pumping until I don't feel it, and I'm going to say I stop feeling it at 120. So I want to release the pressure, let their arm relax, and then I would come over to this arm to check the actual pressure. So since I stopped feeling the pulse at 120, then I need to go 30 above. So I'm going to pump this one up to 150. So for my blood pressure on my patient, I got 148 over 72. And then I want to come back to my patient over here, remove the cuff, tell them their blood pressure was 148 over 72. It's a little bit elevated, but you do have some blood pressure medication that I'm going to be giving you this morning. Do you have any questions for me? No? Okay. I want to make sure that I cover my patient back up, make sure they're comfortable in a safe position with their bed lowered, their bed locked. If I needed to have their side rails up, I would have those up. Their call light is within reach. And then I'm going to leave the room, perform my hand hygiene again, and I would document my findings. I would document the blood pressure, that I took the blood pressure in their right upper arm. The patient was lying supine, and if I did any teaching. If there were abnormal findings that I needed to report, I would do that.